Hi, this is Bobby Maxner. I'm going to cover organizational impact of our final group presentation. The original problem we were presented with is nurse attrition in a large urban hospital that was experiencing a backload of behavioral health patients in the emergency room. The providers and staff did not know how to deal with these patients, and many of them are leaving. HCAHPS scores are down, and there's a lot of crowding, and the psychiatric patients are spending a lot of time in the ED. The problem-solving strategies our team decided would be best were to have a preliminary investigation, improve training for ED staff, provide an appropriate milieu for psychiatric patients, get more psychiatric providers in the ED, and improve triage and assessment using guidelines and tools. So the proposed innovations and changes would make a lot of changes in the organization, including physical buildings, human resources, patient care and throughput, and organizational culture. In the process, the original goals were achieved of decreasing nurse attrition and improving care for behavioral health patients, increasing HCAHPS scores. So revenue would also be increased, but there was some unintended consequences as well. Now, the potential value to the organization includes both intended and unintended consequences. So, as I said, most of the intended ones were covered. We did create a separate ED area for psychiatric patients on the same floor, that it's not attached to the emergency room where the less acute patients can go. They can have visitors there, they can read books, play games, and there's a day room with a TV. The improved screening process was implemented with guidelines that are national recommended guidelines and assessment tools so that everyone was on the same page using the same tools in the ED for psychiatric patients. Psychiatric providers were brought into the ED, including nurse practitioners and psychiatric physician assistants, as well as psychiatrists who can see the patients every day and see if they still need to be in the ED, or they can be provided step-down care with a place in the community who we worked with to get that care provided, or they can be discharged home or discharged home with services. Education and training for the staff was provided by bringing in nurses who have behavioral health experience and cross-training them in the ED. The ED nurses are learning from the behavioral health nurses, and so it's a very synergistic effect there. So the original goals were achieved. The unintended consequences are also an opportunity for improvement, and those include continued crowding in the ED because of the increased perception of improved care. More people are coming there, and it's known as the Psych ED. There's continued crowding in the ED area because not all the patients can go to the other area on the floor. There's a more safe environment because people had input into these changes. They voiced what they thought issues were. They made changes, and so they feel now that they can speak up. Adaptive capacity was increased, so the organization as a whole can start to take on the change as the norm, which is covered in our textbook. And so since people experience being part of changes, they're more willing to make more changes and be a part of future innovations. Also, there's cultural transformation, which just has to do with the Institute of Medicine calling for this cultural change. Ideally, changes would modify the culture to better take care of patients and be able to take part in the change process, such as the one that was envisioned here. The organizations are featured in a book who implemented the IOM standards, and there's a book called Pursuing the Triple Aim. So the three goals of these organizations were improving the experience of care, improving the health of the population and working with the community, and decreasing per capita costs. So with the changes that we made here, all three of those would be implemented, and it would be a great setup for the future and future change in the organization and possibly in other facilities who can look to see what happened there and learn from it. Thank you.